everybody, and thank you so much for joining us. I wanted to take a moment to introduce myself. My name is Maria Prairie, and I'm the Chief Operating Officer at Wello. For those of you not familiar, Wello is a virtual healthcare program that we've been operating on a national basis. I am so thrilled this afternoon to be joined by Dr. Wendy Smeltzer. Wendy is our Medical Director at Wello and our clinic in Calgary InLiv. Wendy has been practicing medicine for over 30 years, having graduated from the U of T Medical School. She did her residency in both Toronto as well as Calgary, and has been active in family medicine as well as corporate medicine for a number of years. So Wendy is going to help us this afternoon. She's going to go through the medicine side of COVID-19 situation, and then I will take some corporate related questions and go through that, and we're so thrilled to have you with us. Thanks so much. So Wendy, I'll hand up.
Great. Thanks so much, Maria, and thanks everybody for joining us today. I know it's really quite an unprecedented time, not just here in Canada, but in the world. And you know, we've really been dealing with things that many of our public health experts have been preparing for many, many years, but it's something we actually have never addressed in our lifetimes. The last pandemic in the world was back over a century ago with the Spanish flu, and of course in those days things were very different. We didn't have the interconnectedness that we have now, the travel we have now, so these really are unprecedented times. But I must say we are extremely fortunate here in Canada. We have a very strong public health agency that is really on top of our situation and giving us incredible advice on not just a daily situation, but actually situations are changing by the hour these days. Our statistics are changing very quickly. I think many of you know we're up over 440 cases now, and we're actually in now have COVID cases reported in every province. We have 4 deaths currently in Canada, although these statistics, as I say, are changing on a regular basis and changing quickly. So I really want to just take a little bit of time to give some really good solid knowledge about COVID, and it will really help make things seem a little less daunting, and some of the things that we can do as citizens, as employers, as employees to really help our public health agency keep this in control. So I want to start with a little bit of information about the virus itself. The virus, which is a coronavirus, coronaviruses are a family of viruses that have been around for many, many years. And in fact, the common cold is caused by a coronavirus. About 15 years ago, in the past 15 years, we've seen 2 other mutations of this virus. One was SARS, that I think everybody remembers quite vividly, and the other was MERS. And these were mutations of that coronavirus that were new, novel. We now have our 3rd mutation, which is this novel coronavirus called, the actual virus is called SARS-CoV-2, but the disease is called COVID-19. So we tend to talk about it as COVID-19. And this virus actually lives very well in bats. That's a really common host for this virus, and it's assumed that this is where it began, was in a bat, and then transmitted over to what we call an intermediary animal that as it mutated and then continued to mutate and transmitted into humans. So this virus is actually a respiratory virus, and by that what I mean is that the virus is transmitted through respiratory droplets. So this means that when you cough or sneeze, those secretions harbor that virus. Now the good thing about this virus is that it is droplet carried. It is not aerosolizing on its own, only if in a medical situation where it is forced to be aerosolized, but it doesn't aerosolize on its own, so it sticks on the droplet. And that's a good thing for transmission, because if it ends up spontaneously aerosolizing, then it can spread much more widespread. That's the case with viruses such as the measles virus, why it's so highly contagious. So with this virus living in droplets, that means it's carried by those secretions. And we know it's a fairly heavy virus. And what that means is that within 1 to 2 meters, that virus drops. It falls down with the droplet, and it doesn't continue to spread in the air. So that's the first thing to know about the virus. The second thing is that this virus multiplies inside cells only. It does not continue to multiply when it is outside of the body. So for example, that secretion within you is breeding virus. The minute you cough or sneeze and the secretion is outside of you, landing on a surface, it will continue to live for a period of time, but it doesn't continue to multiply. So much like funguses and some of our other things that continue to grow outside the body, this does not, and that's a good thing as well. Now, it does tend to live outside on surfaces, and depending on the surface, there are still some studies going on to try and determine exactly how long, but we know it can live as long as hours on some surfaces such as copper and some metals. It can live up to about 24 hours on paper, cardboard, and we know it can actually live up to 3 days, or it's felt that it can live up to 3 days on some other surfaces like plastics. So we know that it will live outside the body, and that is part of our transmission vector. Now, what we don't know is how infective it is as time goes on. So if something stays on a surface for 3 days, is it as infectious day 3 as it is right away? We don't have the answers to all of these questions yet, but we know that obviously with immediacy of droplet secretion, they are highly infectious. So what this means is that if someone is doing their due diligence and they're coughing into their elbow or their hand, and then they go immediately and touch a doorknob or touch the elevator button, you are right behind them and your hand then touches that elevator button or that doorknob, and then you happen to have a little itch in your nose and scratch your nose or your mouth. That's how we can transmit this virus, in addition to being exposed directly to sneezes or coughs. There was some new information that I think was circulating around the internet yesterday, that the WHO announced that it could live in an aerosol, but these were in what we call forced aerosolization, or meaning it would be in a situation where a medical instrument aerosolized it and it could live, but it is not felt to spontaneously aerosolize at this time. So this is really, when you look at the transmission, this is really the basis of what our public health recommendations are telling us. First, stay home if you're sick. If you have secretions and they have virus, we don't want them spreading out in the community. So we want people at this time, with any cough, cold, sneeze, any risk of those secretions being spread, to stay away and stay home. This is where our social distancing comes in as well, because we know, as we talked about, that virus being heavy and dropping by 2 meters. So if we keep our distance 2 meters apart, even if somebody should cough or sneeze, the risk of us inhaling those viral particles is minimal. So that's where our 2 meters, or roughly 6 feet apart, guideline comes from. And this is why we're also talking about limiting contact, close gatherings, shaking hands. All of these measures are really to prevent that direct droplet spread. The third recommendation, and why we have that, is washing hands. So if you do pick up virus by touching things that inadvertently you touched when, a supermarket handle, a doorknob, the things we talked about earlier, if we can wash our hands frequently, we can remove that virus. Simple soap and water, that 20-second, I think there's been a lot of jingles going around. If you sing Twinkle, Twinkle, Little Star was the one that we were taught way back in medical school. But to wash your hands and wash them frequently and well, and not touch your face, because that virus, if it's on your fingers, is not going to be inhaled by you unless you put it close to your nose or mouth, or it can also transmit through the conjunctiva of your eye, so we don't want you rubbing your eyes as well. So that's where the guideline of not touching your face comes from. So if you think about how the virus works, this is why those public health recommendations are now in place. So I'm going to talk a little bit now about the disease itself, COVID. The incubation period, we know, is somewhere between 2 and 14 days. The average is about 5 days, but it can be delayed as much as 14 days. And this is where our guidelines for incubation come from. We know once you've isolated for 14 days that you are unlikely to have that virus from a contact that you had 14 days previously. When we look at the disease, 80% of COVID infections are very mild disease. And by mild disease, it can present just like a common cold or a mild flu or a moderate flu. So cough, sneezing, sore throat, runny nose, mild fever. Those are the mild presentations that we see in 80% of people. But what we do know is that 20% of people, that disease can progress and become more serious. And of the people that continue to progress, we know in that 20%, 5% it can progress quite seriously. And the 20% may end up requiring urgent care, hospitalization, and certainly the 5% that progress to very serious disease require usually intensive care and ventilating support. So we know that people who are young and healthy tend to be more resilient to this virus and tend to get milder versions of it. Interestingly, we're finding that children tend to be more resilient, and thoughts are that their immune system is just a little more flexible. And as we age, we lose some of that flexibility in our immune system. So people who are over the age of 65 and people who have underlying medical conditions, particularly immune compromised situations, multiple chronic diseases, they of course are in that higher risk group that have more likelihood to progress. But we really need to know that everybody is at risk. And why everybody is at risk is this is a new virus. And when it's a new virus, we have no immunity out there in the community. So everybody is at risk of getting this virus. And that is unlike the flu. The flu, we have many new strains that come in every year, but we know that we have partial immunity from our exposure in the community over many years of flu viruses. So with partial immunity in the community, not as many people will get it, even though the flu virus is circulating. So this is different than this new coronavirus where nobody has immunity yet. Unlike the flu virus, coronavirus colds has not given any immunity to this disease. So when we look at transmission, right now it's felt that every person with a COVID infection will potentially infect 2 to 3 other people. And if you start looking at the math of that, if one person infects two people and the next 2 people affect the next 2 or 3 people and so on, this is how we end up having spread. The predictions vary and different experts are looking at this on an ongoing basis, but recent predictions are that we could affect anywhere from 50 to 70% of Canadians. The majority will be mild disease, but we do have to be aware that this is something that everybody is vulnerable to. The other concern about this virus, as opposed to the flu, is that it is more deadly. The mortality rate from this is about 10 times higher than our current flu. It does rise with age, and of course the highest mortality statistics are in the over 80 age range, and it can be anywhere from 15 to 20% in that age range. So this is serious. The other thing we don't know about this virus, because it's new, is we don't know whether the weather will change this. We know that with our flu viruses, with many of our common cold viruses, when the warm weather comes, when they're more common in the fall and winter, and when we hit our warm weather, these viral activities tends to go down. And we don't know with this virus yet. We're all hoping that that will be the case. It's something that is certainly under study now. The other thing to know about the disease itself, COVID, if you get it, is there's no specific treatment at this time. We are recommending just the usual things we would for anybody with a cold or flu, and that's rest, lots of fluids, analgesics, and of course the public health measures that we've talked about. There is some new information emerging out of studies, and there is some possibility that if you're taking an analgesic, a better choice would be acetaminophen, which is commonly known, one of the common brands being Tylenol, and not using anti-inflammatories such as ibuprofen. And the reason for this is ibuprofen, or one of the common names being Advil, is an anti-inflammatory, and with suppression of inflammation, the virus actually may replicate even more. So we know we're starting to see some statistics that people who take ibuprofen do not do as well as those with acetaminophen. So these are still under study, but there's sort of preliminary talk about this in the medical community. We don't have any other specific drugs at this time, but there is some under study, and apparently there is one being studied right now in Seattle that looks very promising. And when we do drug studies, if it's an existing drug for new use, that can come through far more quickly in approvals and recommendations rather than developing something brand new such as a vaccine. And vaccines are certainly under investigation now, and my understanding is there are some that are really very promising, but they do take time in order to study them because we're looking at building immunities, and that can take many, many weeks. So these are slower processes, and the current estimations is it may be a year or even a little longer before we can have a good vaccine for this virus. Tamiflu, which I think a lot of people may be familiar with, which is an antiviral medication used in common flus, it does not work for coronavirus, so it's not a recommendation at this time. But one thing, you know, it's often very difficult because the symptoms of COVID-19 can present very similarly to the flu. So there's a lot of similarities, and it certainly is something that one of the main factors that differentiates the two, or one of the common difference, is that travel is a huge risk factor for the coronavirus. So, however, recently, I think as everybody's aware, we're starting to see community spread. And by community spread, what we're talking about is people within an environment spreading to each other and not picking it up through travel outside. So this is person-to-person spread without travel, and these cases are now starting to appear. And that is why in the last week in particular, we've seen such an escalation in some of the recommendations coming out. Person-to-person spread really is a game changer when we look at public health measures. And this is why we're seeing some of the increased measures in place now, like banning mass gatherings and isolation practices. And with travel being one of the biggest risk factors, we're now starting to see borders changing and international flights being recommended not to fly, etc. So this has really changed our public health recommendations more rapidly in the last few days. So another question that often comes up is, why, if the majority of people just have very mild disease, why are we so worried about isolating, and why are we worried about transmission? And you've probably heard of this whole concept of flattening the curve. And what that refers to is, since everybody right now is at risk of getting this COVID-19 infection if they're exposed, as that exposure increases, the surge in new cases increases. And if we have a surge in new cases, 80% will be fine and just stay home and get better, but that 20% increases as well. And that 20% requires hospital care, and we know that 5% can require intensive care support. So as we see a big surge in cases, the burden on our healthcare system and hospitals in particular becomes huge. And we never want to reach the point where we cannot manage. As the burden increases in our hospitals and our emergency rooms and fills our ICUs, we still have other ongoing medical emergencies that happen. We still have motor vehicle accidents. We still have people having heart attacks and strokes that need immediate urgent care, and we need to make sure we have enough hospital resources to help everyone. So this is why our public health advisories are so important. And as I mentioned earlier, I think we are very fortunate in Canada where we have a very strong public health agency. One of the challenges that everyone, I think, is experiencing right now, especially companies like ours that work across all provinces, is that our provincial jurisdictions actually have their own medical officer of health and work with their own advisories in public health. So it can be confusing because you can see some variations province to province, but all of them are monitoring the unique situations for their province and making very similar recommendations, just the timings may change for different provinces. But one consistency that we do have across our country is the ability to do testing, and we're very fortunate. We have tests that are available in Canada. We do not have shortages at this time, but we do have across the board that testing is only indicated for people with symptoms. So if you have symptoms and you've traveled outside of Canada, or you've had a known contact with somebody who has COVID, then testing is definitely advised. The testing is done by a swab that's put down through the nose, goes down to the back of the throat between the nose and mouth. It's called a nasopharyngeal swab. It's not a blood test, but it's a swab. And we do not recommend testing people who have no symptoms at the time. We do know that there may be virus present in people before they have symptoms, but when we look at testing, the viral load we think is very low in the people without symptoms. It just hasn't replicated enough to give people symptoms. So you could do a test and have virus but have it reported negative, even though there's a low level of virus there. And we don't want to falsely assure people that maybe the following day will have symptoms and viral load enough that the test would then be positive. We also want to make sure that we don't have shortages and we keep those tests where we know they are going to be more accurate. So this is the recommendation at the time, is that we don't test asymptomatic people. If you do not have symptoms but you've traveled, or you've had contact with somebody who's known to be COVID or a suspected COVID case, then we do recommend at this time not testing, but self-isolating. And that means staying out of public venues, remaining in your home, distancing, all of those public health things we talked about earlier, self-distancing, hand washing, not having immediate contact when you're in isolation, and watch for symptoms. The minute if the symptom begins, then testing is indicated. And you can look even in the situation we have in our country with our Prime Minister being isolated and not tested until, if ever, symptoms occur. So we want to ensure that everybody recognizes the importance of self-isolation. You know, in Canada, it's a recommendation. We're counting on people being good citizens and following our public health recommendations. We don't want to see people going into large public gatherings or to host large events in their homes, or with schools being canceled, having children congregating in groups together. We really want to encourage the self-isolation. And should symptoms develop, we really would like people to use telemedicine services such as Wello and other platforms that are there to ease having people with suspected COVID in healthcare settings at the time. So use your telephone, use your telemedicine platforms for these issues. Now, if somebody does test positive, then they obviously continue in self-isolation. And once their symptoms resolve, they will have repeat swabs done. And we need to have 2 negative swabs spaced 24 hours apart before someone is deemed no longer infectious. So these are the current recommendations. And as I said, things are changing quickly. And we could be saying something entirely different next week based on what happens and what evolves over time. So while we're here, I also want to just talk a little bit about masks. Masks, as you know, we're starting to see many people out there wearing them, and I think people are aware that we're starting to have shortages in our supply chain for masks as well. Masks are really designed to be used by people who have symptoms. So this is a shield in order to protect those droplets from spreading out and spewing into the environment and within 2 meters affecting somebody else. So they are not meant to be for asymptomatic people, apart from healthcare workers. Healthcare workers that have to look in people's mouths or care for them, often their masks are removed, the particular patient, so the healthcare worker needs to protect themselves because they're in short range of these droplets. There has been some concern raised by some of our infectious disease specialists that wearing masks when you have no symptoms may actually increase your risk, because when you breathe into your masks in and out for a period of time, they become a bit moist. And once you get moisture on a mask, particles that, droplets and other things out in the environment may actually stick on that mask, and you may then increase your risk of inhaling something that you shouldn't. So we don't recommend asymptomatic people just generally wear masks, but definitely should you have symptoms, it's indicated. There's also been questions about the N95 masks, and N95 masks are designed to prevent those very tiny aerosolized particles from penetrating. And as we know, this is droplet carried, unless, again, you're in a healthcare setting, a dental setting, a hospital setting where there are machines that might aerosolize those secretions. An N95 mask is not indicated, even for people taking swabs from patients. So I hope that's given a little bit of understanding of the virus and the disease and how it's spreading and why it's so important that we all really heed the public health recommendations that are out there now. If we all really do our part and follow those recommendations, which means staying home when you're sick so you don't spread those secretions, social isolation, really following those practices, washing your hands and not touching your face, then we can really start reducing the transmission of this virus. And that's not just for our own, personal health, but we're talking about the health of our community as well. Right now, we really feel that nobody can predict how long this is going to go, but certainly the experts in this field are talking months, not weeks. So this is becoming our new normal right now, and I think it's very important that we all do our part. We recognize it's having significant impact on people in their daily lives, certainly in view of some of the more recent things of this past week with closure of schools and large venues and restaurants. And we're seeing so many actions being taken now, so we know there's an impact, and certainly an impact on businesses, which is why I want to turn things over to Maria now to talk a little bit about some of the impact on business, and then we'll open up for some questions, because I'm sure people have some very interesting questions and things pertaining to their own situation. So I'll turn it over to you, Maria.
Fabulous. Well, thank you so much, Wendy, for a very comprehensive, in-depth look at COVID-19, how it impacts us and what we can do to really head off not only our risk, but do our part in terms of social responsibility to minimize the risk of it peaking and really flatten that curve. So I would like to spend a few minutes just talking through the business considerations. We've had lots of inquiries from our customers, both calling into Wello as well as at our executive level, asking for guidance and help as they try and manage through this situation. And so I think, there are lots of resources out there, and those resources are on our website. For example, both Ministry of each province as well as the Ministry of Health nationally have access and links into resources by WHO for employers as well as the CFIB. And it can give you some information and some guidance and answer some questions as you try and figure out to do what if. I think the most basic thing here is that occupational health and safety standards really dictate that the employer has a duty of care. And that duty of care is related to protecting their employees and doing their absolute best as reasonable within any circumstance to ensure the health and safety of their team. And so there's kind of two sides to that. One side is, the individual who has traveled and now they're coming back to work. They may or may not be symptomatic. In recent days that our governments have made decisions and our ministries of health have made decisions on what our next steps as employers should be in those circumstances. And we've been very clearly told that if an individual has traveled outside of Canada, that they should, regardless of whether or not they have symptoms, self-isolate for a period of 14 days. But let's say that an individual calls into work and they are now exhibiting symptoms. What do we do about that? And so I want to spend a couple of minutes talking about how we've dealt with that at Wello and InLive, our clinic in Calgary, to give you some examples of how we deal with it. And then I'll talk a little bit more about remote employees. So the way we have chosen to do this is we've done what I call a classic pandemic plan. We sat down, we figured out who our essential employees are, and essential in what physical location, because in some cases, particularly with a primary care clinic, we will probably stay open in that clinic longer than most organizations or organizations that can send people remote. So we do have essential employees that have to be in office, and then we have essential employees that we're able to ask to work from home. But the moment that someone lets us know that they're feeling unwell, or maybe they don't feel unwell, but they have a low-grade fever, we actually ask them not to come into the office. And so we do have circumstances where we have people who've traveled for personal reasons, and they come back, and now they're in isolation working remotely. And in other cases where someone may have exhibited some symptoms of feeling unwell, and so we've set them up as well to be able to work remotely if they feel well enough. But the key thing here, as long as they continue to feel well. And so, this gets very interesting. Managing remote employees really as well has two contexts. So we've had some questions from some of our corporate partners who have fly-in camps or maybe work on oil rigs. How do we know if somebody can go into that camp? We certainly do recommend that you go to the resources that are available to you in your ministries of health and at the federal level as well. Some things, though, to consider would be, does that person feel unwell as they're going? We do know that they may exhibit symptoms after they get there. So if they feel well, they go to the remote site. Now they start to exhibit symptoms. We need to make sure that there is a place for them to isolate there, and for you then to contact through to your resources, your medical resources that support you at those sites. Most, but not all, organizations have occupational health and safety protocols and standards, and they will have to find what those standards are for this circumstance. If you haven't done that yet, I would invite you to do it. And I would invite you to be very clear with your teams what that looks like and what that means, so that there is no question that when an individual comes into work in a day, that this is your expectation of them. You're expecting them to feel well, not to exhibit any symptoms. If they've had a documented exposure to an individual who has been diagnosed with COVID-19, it really is your decision as to whether or not you allow them or want them in. And our suggestion is that you use the resources that you can to try and make some of those decisions. In our case, I will tell you what we have done. If they exhibit any symptoms of any illness, we ask them to stay home. If they've had a direct exposure to COVID-19, we ask them to stay home and self-isolate for 14 days. And if they have traveled from outside of the country. But these are decisions that as organizations you will need to make for yourself, really just providing you this in terms of a guideline. For those organizations where people have to come into the office. So, it's trying to provide a space so that we can have social distancing while at the office. Things as simple as respirators. There are many organizations where their teams wear respirators as part of their job. And so in doing that, making sure that that respirator continues to be clean. Dr. Smeltzer spoke about individuals using masks. This is the same kind of situation. And so making sure that you have them meet and in some case increase that level of cleanliness. And then of course, it's just making sure that you have a very heightened approach to cleanliness within their work site. So why don't we take a few minutes and open it up to questions?
So I'm going to just start with a couple of them here. Let me just get them here. The first thing somebody asks, if a person calls into Wello, can Wello prescribe or send out a COVID-19 test kit? And unfortunately, the answer is no. All of our test kits are monitored and distributed through our public health agencies in each province. So they're very carefully regulated by them. We have screening centers now set up in most cities in Canada. And in fact, if you look at how the screening centers are now being set up, is we don't even want people going anywhere to get a test done in terms of a public place. Many of them now are setting up drive-throughs, or you stay in your car until your allotted time and come in individually to get the testing done, because the last thing we would want is to have a number of people possibly at risk congregated together and continue to spread that virus. So COVID testing is all done through our public health health agencies. And if you have any symptoms and you've traveled, as we've said before, within 14 days, if you exhibit any symptoms, a cold, sore throat, runny nose, etc., self-isolate, and then you need to call your public health agency and they will arrange for testing to be done. They can be done in physician offices. However, in order, as we talked about earlier, with the type of protection a healthcare worker needs, if you went to your local clinic to get testing done, they would have to have what we call full PPE, or the personal protective equipment, meaning they would need eye shields to protect their eyes, masks so that as they do a swab there is no secretions generated, and they would need to have complete coverage of their person and then discarded after. And sadly we have a shortage of these PPEs, and they're being mainly diverted to hospital settings where there is a high risk. So this is the reason screening centers are being set up, because the public health is now really monitoring very, very carefully these testings and ensuring that they can track the contacts. Because should somebody test positive, as I said, we have an excellent public health system. They go in and they investigate. If it's in a workplace setting, they actually investigate the workplace setting. Who is sitting within 2 meters? How much exposure do people have? They will trace contacts, and public health will then arrange for self-isolation of those people, and should symptoms develop, then they get tested. So this is why we don't want any, there are no private testing kits. I am sure if you went on the internet somewhere you might find something, but I would not advise it. Even in our provincial and federal health agencies here, initially in the early days of testing, all the testings were done initially in the province in their labs, and then the samples were also sent to our major viral lab in Winnipeg and double checked. And once they determined that there was good validation of all the tests, then they went to provinces being able to do their own. So you certainly don't want to be getting test kits off an internet and trying to do this yourself. Rely on our public health agencies. Testing is really being done very efficiently. However, despite the efficiency, I have a question here saying, I can't get a hold of anybody when I call my public health number. And I waited on hold 2 hours, what do I do? We just have to understand that this has escalated so rapidly in the last week in particular that it has actually just flooded the system. But they are putting measures in place now to really increase personnel to answer those calls. I know I was dealing with a lot of this on the weekend, and statistics from our local Calgary area in Alberta is they fielded over 60,000 calls in one day. So the call volumes have really risen in the last week in particular. So they are putting measures in place. The other thing that you'll find is that there are many of the health authorities are trying to do something electronically and screen you and then divert you into that. So I think we'll see many increases in availability of our public health agencies. It's just this past week was extremely difficult. But if you do, that is the place to call. That is where our testing is arranged at this time. As I said, things can change, but I'm giving you the current information for now. So another thing, let me just see. Here's another one, Maria, for you. What do we do about company meetings?
So that's an excellent question, Wendy. With respect to company meetings, I mean, we have largely gone remotely. I'm in Toronto, as you see. I'm in my house, in my living room doing this webinar today. And so we use a video conferencing service similar to the one that you're on today. And it enables us to continue to keep in touch, which is so important when you're working remotely, but as well to continue working with our normal day. And so that's how we do that. I would not recommend at this point that we have large gatherings. I know, dependent upon where you are in the country, provincial governments have come out and said, you know, you can have a maximum of 10 people, you can have a maximum of 50 people. Ontario this morning came out and said a maximum of 50 people. But there's really lots of other creative ways that you can get together for meetings. So it's really not necessary to do that in person if you can avoid it. If you're not able to avoid it, then I would actually recommend open space. I would recommend that you have enough space between individuals, and to really, just work very hard to keep individuals safe. And of course, if somebody is not well, they shouldn't be in that work environment. Wendy, just before we get started, I want to remind everybody that you can put your questions in the bottom of your screen, and then we can get them and answer them for you.
Great. Another question here, what resources are there for my staff and family? And that's an excellent question, because I think the internet right now, although it's a wonderful tool for us, unfortunately there's a lot of misinformation that gets circulated, and certainly sometimes things can escalate even when they're not absolutely correct. So we're going to put a list of resources up at the end, but in Canada, one of our best resources is canada.ca. If we go to our Canadian official site, our public health is keeping updated. Sometimes I find that there can be a little bit of a lag in some of the provincial recommendations that happen, so you can also, it will eventually get there, but as you can appreciate, things are changing so quickly that sometimes there's a little lag between what you might hear on the television or radio or the internet and that site, but they will be accurate when it's posted. All of our provincial public health agencies have excellent websites, and that really, for each province, should be your source of truth. So if you go to your government, your whatever province you're in, public health agency, their site will guide you for all the guidelines for your particular province. As I said, there are some minor variations province to province. Some have declared, as you know, states of emergency. Some have not. Each public health group is very carefully monitoring the spread of disease and how it's spreading within their community, and taking steps accordingly. You know, there are big steps to have restaurants and businesses close and ban people from having their conferences or attending school. So these are decisions they really do not make lightly. They look at all of the information that's come in and they spread within their community, and they make those decisions accordingly. So I would say those are your best sites for Canada. Going to the WHO site and the CDC site, Centre for Diseases Control site, that CDC is American, so the information is a little more skewed towards American recommendations, but it's interesting to watch what's happening there. WHO takes a global look at things, but these are all very validated sites, and they are the sources of information that I think would be, and they are not just reporting on cases or what is actually happening. They actually have some tremendous resources for you in terms of what is self-isolation, what does that mean, and very specific in recommendations. They also have, many of the provinces have information for employers on there, information for employees, information for those of you that have children that are in daycares. They have some really excellent resources, and that's where I would guide people to go. As the recommendations change, they are constantly updating. I'll just share with you, in our specific organizations, we started with emailing, trying to email to keep our clients abreast, but things were changing so quickly, by the time we get it out, there might be something different. So now what we are doing in our communication is letting people know of processes or things that have changed within our organizations, whether it's Wello or a clinic, and then directing people to those provincial sites to get the most up-to-date information, because they are the ones that are giving us that accurate information. So I hope that answers your question. It doesn't tell you specifically because it's by province, but that's where you would get the best resources. I have another question here, Maria.
Okay.
Let's see. What do we do? Well, you may have answered it a little bit earlier, but what do I do with employees residing in another country?
So that, again, and it goes back, Wendy, to the resources and the resources that are on hand. So in some cases, if they're Canadian and they're working as an expat in another country, The Canadian government may have specific criteria by which you can determine how to get them back, and they may actually help with that, as I read in some of the sites today. And so, that would be my first step. The second step is they really do need to follow the guidelines and the criteria and, frankly, the limitations that are imposed in the country that they are in. So, for example, if you were working in Italy, you have to follow the rules and regulations that have been defined by their bodies, their governing bodies within Italy. But I do know in that case, Canada's worked very hard to repatriate Canadians back into Canada.
Mm-hmm. And I think there's always, like we talked about before with remote meetings, there's ways you can continue to try and communicate, to your workers abroad, through having meetings and things through our internet meeting platforms. Yeah.
Absolutely. So, and Wendy, we find that many people can, I'm working remotely. I'm just as productive as I am in my office. And so, not being able to physically go into the office doesn't mean that you can't be productive. And if someone has to be in their particular job, some of the techniques that we're using is we're actually redeploying them into other roles.
Right, exactly. So I have another question here. Do we need to close an office or a factory if a worker tests positive? That's an excellent question, and I think one that a lot of people are fearful of. If somebody tests positive in their office or their factory setting, does that mean everybody is in isolation? And that it's really quite extreme that public health would ever actually shut something down. What they would do is, if there was a positive test in a factory worker or in an office setting, they would actually come in and they would look at that setting specifically and then determine who are the close contacts. Those close contacts would require isolation. They would certainly recommend intensive cleaning. As we talked about earlier, we do have the virus living on surfaces up to a couple of days. So if you have somebody who's positive and has touched the door handles and the water fountain and whatever, they would recommend, and they would recommend specifically how to clean for that setting. So the only time you might be closed is if you had to do a cleaning, but this would be within public health's realm to determine the extent, but it would be rare to have a complete closure. We've had some people voluntarily close their business when something has happened, but that was not mandated by public health. And they are very, very careful. They certainly do not want to see something increase through a business, a factory, a work camp, etc. So our public health advisors, that is their expertise, and they will make the recommendation that's appropriate for that particular instance. But you do not have to be fearful that if one person is positive, your business has to shut down. In fact, I think we all have to brace for this new normal. It will likely get to the point where everybody will have somebody positive within their organization. So we just have to be prepared for that situation and know that public health will guide us accordingly. I've lost. There we go. Okay, I have another one here. What is the best approach when you know someone has symptoms but they refuse to self-isolate? So I'll take that one. I've just lost my audio here, so I want to be able to hear Maria and others, so I'll just get that going there. So what is the best approach if you know someone has symptoms but is refusing to self-isolate? I think that's a very difficult situation, because all we can do is appeal to people, explain the rationale for it, and appeal that they will be a good citizen and try to prevent this spread. I do think people are starting to appreciate how transmission is escalating and how it's escalating quickly. We do not want to see ourselves in a situation like Italy, where things get out of control despite, first world hospital care, but because the transmission was not contained soon enough. So it's just right now, as I said, we do not have laws that say we have to. We have strong advisory from our public health agency, and we're just appealing for people to be good citizens and follow that. So I would say a frank discussion with the person you know and just advising them, recommending they go to the websites and have a look and see that information and make their decision, hopefully according to our public health measures. So we have another question regarding employees within a workplace. That seems to be a common concern. If an employee is diagnosed, how is the sanitation area to be done? And really, viruses, they are quite readily removed from surfaces with our typical antiviral things. Even a bleach and water solution can kill viruses. We have excellent products out there that can be used as long as it's a virucidal product. But believe me, if an employee in a work setting or a factory setting or a camp setting, any of your particular settings that arise, public health will be involved and they will recommend what the cleaning needs to be done and how extensive it needs to be done and what needs to be cleaned. So no worries, you don't have to figure that out on your own. If that happens, you're going to get lots of support and advice. We, as I said many times here, we're very fortunate. We have a strong public health system and they're here to support all of us in those times and make sure they want to ensure the right things are done. Their job is to try and contain this virus and give us the appropriate recommendations. So I have another one here. How do I manage employees remotely? It's a tough one.
So I'm happy
Maria.
to get that one. Yeah. In my career, I've managed many remote teams and supported many remote teams. And, I think communication is the thing that's actually going to make the difference. And certainly we are over communicating in our organization today. This is probably my 10th meeting since this morning on Zoom. We tend to do everything through video. It adds a really nice sense of actually physically being with the individual, and so that does certainly help. But it goes back to managing people overall, setting clear guidelines, clear timelines, leaving room for questions and clarifications, and keeping in touch. And right now, and certainly we understand this as well because we do have our own teams to be concerned about, there's such a heightened level of concern, and the news is changing in some cases minute by minute. You go to bed and you get up the next morning and there are 5 new changes related to this particular situation. So we do go out of our way to communicate to our teams, to reassure, to help them to understand what steps we are taking to minimize risk to both them and to our organization. But as well to help them just feel okay, that everything is going to be okay. And we have even gone to the extent of helping them better understand what social distancing means. And for those that have been traveling and have come back, what is self-isolation, and enabling them to ask those types of questions of us. So it really is all about clear expectations and communication and being there to listen as leaders as well, Wendy. And certainly we see lots of this. You've done this a lot in the last 2 weeks. Really sitting back and listening and hearing sometimes the things that are not said, so that you can reach out to an individual you think may be concerned overly or overly worried, and just chatting with them and making sure that they continue to stay connected with you. Absolutely.
We'll take a couple other questions. One is, what advice should we be giving to pregnant employees? And certainly we know pregnant women are not at higher risk of COVID. They're the same as every other person. So obviously we want, but in that situation we don't want pregnant women getting unknown viral infections through their pregnancy. So certainly the same recommendations we have, if they have been exposed or are concerned about exposure, they should be home and self-isolate. If any symptoms, they should be home. We want to ensure our workplace follows those Canada Health guidelines, our Canada Public Health Agency guidelines. We need to protect those people in the workplace by not allowing people in that do have active infections, colds, coughs, flus, etc. And I think we're now moving to the point in many provinces where we are encouraging people that can work at home to work at home. And so obviously looking at remote work, if someone in a pregnancy situation, may be more anxious or concerned than others who are not, that we take into account their considerations and look at our individual organization. And there's no legislation that says you have to send them home or self-isolate, but I think we all want to be sensitive to the situation and do what we can to protect all of our employees, including pregnant women. If we can have them work remotely, we can consider that if it works for your particular business. But pregnant women are not at higher risk, but like every other person, we want to protect them. One other question is, if I've tested positive for COVID, how long do I need to self-isolate? How long after symptoms subside? And that question isn't completely known yet. As I mentioned earlier, our current suggestions or protocols are that if you are tested positive, you stay home. Obviously, we don't want you in the community if you have tested positive. This is where self-isolation and even that social distancing within your family is very important. But if you're positive, once your symptoms have subsided, and that can vary, the average is up to 2 weeks of symptoms. Once the symptoms have subsided, then public health will come in and they will test, or they will arrange for you to go for testing, and you need to have 2 successive swabs 24 hours apart, negative, and your symptoms resolved before you're considered completely healthy and able to get back into the community. The time frame from the subsiding of symptoms to when they become negative varies person to person. I've heard of some that have gone up to 4 to 6 weeks after, but we don't have an absolute critical number that we can give you. This is information that is now coming available. We may have more information over the next couple of weeks, but you're not going back to work the day your symptoms resolve. You have to have that viral load go down. You have to stop shedding virus and be symptom-free and viral-free by swab before you can go back into the community. So I think we're just about running out of time here. I think
we get one more?
Oh, one more question? We sure can. Let's look here and see. Should parents of children with a cough only self-isolate? These start to get into the challenging things. If children we know tend to be a little more resilient to this virus, we know that there still are many other viruses circulating in the community. We have flus, we have normal colds, etc. Not every cough and cold is COVID. So if your child has a cough and no other significant symptoms and has not traveled outside of Canada in the previous 14 days or had known exposure to somebody who did have COVID, then no, you do not have to self-isolate as a parent. But you should keep your child home until they're symptom-free and not have them circulating any virus with the rest of the community. So one thing I'd like to do is have our resource slide come up, and we can talk about some of the, these are some of the resource slides that are up there. And Health Canada, WHO, I would say adding there just to make sure you go to your provincial sites if there's something that, that you have questions for your particular province. And one thing, we are going to be doing another shorter webinar on Friday, just because we know that things are changing quickly. There may be some updates by Friday that we can share, and we certainly will. And it also may be that some people weren't able to access today. We'd like to be able to share information. So I'd like to thank everybody for attending, and hope this was valuable for you. We're certainly here to support in any way we can and do our part to help contain this situation.
Yes, thank you so much, everybody, for coming, and thank you, Wendy, for such an informative session.
Thanks.